This is a re-recording of a presentation I gave on concussion and post-concussion syndrome at an It's About the Warrior Foundation event that is focused on post-traumatic stress disorder and concussions in military veterans. I've taken my experience as a chiropractor working with football athletes, soccer players, and other types of athletes who have had concussions, as well as patients who have been in motor vehicle collisions, and I'm using that experience now to apply to military veterans who have had concussions. Myself and the other doctors at our clinic, legacy medical centers such as Dr. Thomas Burnett, have come up with a comprehensive program including chiropractic, nutrition, and other technology to help patients and military veterans included recover from concussions. A simplified definition of concussion is a head injury that causes a decrease in mental or brain function, and it is considered to be post-concussion syndrome if the symptoms last longer than 4 weeks. Some of the symptoms of concussion include headache, dizziness, fatigue, memory problems, concentration problems, sleep problems, irritability, and problems tolerating stress, emotion, or alcohol. There is a significant overlap between concussion and post-traumatic stress disorder, particularly in military veterans, and the symptoms I've put an asterisk next to are the symptoms that go along with concussion as well as PTSD, and those are sleep problems, irritability, and problems tolerating stress, emotion, and alcohol. And these three symptoms are strongly tied to the sympathetic nervous system, which is the part of the nervous system that has been called fight or flight. It basically triggers an alert state of the mind, and these sorts of symptoms go along with concussion and PTSD, or post-traumatic stress disorder. Another thing to know about concussion is that it is what's called an invisible wound, because the brain is not visible to the naked eye as it is inside of the head, and particularly in military veterans, it is notorious to not receive treatment or diagnosis of a concussion because the injury cannot really be seen, and a lot of the symptoms are just brushed off. And this occurs in all people, but notoriously over half of the concussions in military veterans are not receiving treatment. And so that's really what we are here to discuss with this talk. In the past 15 years, there have been 274,568 military service members diagnosed with a concussion, also called a mild traumatic brain injury. This represents about 20% of the military combatants of Iraq and Afghanistan, and by some estimates, the prevalence of concussion or post-concussion syndrome is over 60%. In one study from the Veterans Affairs Network of Boston, the VA clinics there, they found that in veterans that were treated in that system, they found a prevalence of 66.8% of the veterans had post-concussion syndrome. So there's a huge variability between the estimates of how many veterans actually have had concussions or have post-concussion syndrome, and like I said before, there are issues with reporting of concussions, and there may be an underdiagnosis of concussion in the military. Anyways, we have over 250,000 of veterans with concussions, and that's a very, very high amount. One important thing to know about post-concussion syndrome in military veterans is that it almost always coincides with post-traumatic stress disorder, or PTSD. And so those two syndromes oftentimes, almost always in veterans, go hand in hand, if not including chronic pain as well. And you can see that PTSD only occurs in isolation in veterans in about 3%, and post-concussion syndrome only occurs in isolation in about 5%. But most of the veterans have one of the other syndromes or chronic pain as well. And in Boston, in the study in the VA system there, they found that head pain was a complaint in 55% of the veterans, and that was only secondary to the most common complaint of back pain. So head pain is basically representative of the headaches or the concussion symptoms, and so almost tied for the number one complaint, which is back pain. So very, very common in military combatants. So what actually happens in a concussion? When the brain is hit, some of the neurons, the long, thin brain cells, actually rip open and they spill out what they contain. And that includes a lot of calcium ions, a lot of excitatory neurotransmitters, and other proteins. And so after a hit in the head, there's a lot of basically garbage or just junk floating around inside the brain. And this causes a lot of problems like inflammation, what's called excitotoxicity, and additional cells and brain cells can die due to the fact that there's an increase in this calcium floating around, and there is a loss of the connections between the neurons and the brain cells, and there's a reduction in the blood flow as well. And so after a head injury, some of the damage is immediate. However, some of the damage continues if the inflammation and the calcium and the other issues are not controlled. One of the simplest, most effective, and least expensive strategies to heal from a concussion is to use the mineral magnesium. And in a case of concussion, what magnesium does is it blocks the entry of calcium into the neurons of the brain, and that protects them from additional damage. It also helps to heal the damaged brain tissue as well. And it is very easy to get magnesium in the diet. From seeds and nuts are very high to things like brown rice. However, supplementing with magnesium is easy as well. You can take baths in epsom salt. There are drinks that have magnesium, magnesium oil, there's supplements, mineral water, and even dark chocolate can be used. This is a case from our clinic that shows how useful magnesium is in treating concussion. We had a 49-year-old man who presented 10 months after a motor vehicle collision with whiplash, chronic daily headache, and dizziness, as all part of post-concussion syndrome. He actually had a fusion of his neck prior to the accident, so as far as chiropractic goes, we were just leaving his neck alone when we started treatment and focusing more on the passive therapies and the magnesium. When I told him about magnesium, he already knew about it because as an ex-college football player, he had taken Epsom salt baths, and so he got right into this therapy. And when he started doing the Epsom salt baths 3 times a week, his headaches were reduced to 1 to 2 times per week. And this case is really important to me because it shows how useful magnesium can be by itself without any other medicines or vitamins or supplements. As far as the research on magnesium goes for concussions, the human research has been limited up to this point. However, we have great animal research, and also as part of my personal experience, magnesium is one of my go-to treatments, always something that I recommend in cases of concussion. In this study, on the right, I have a picture here of a rat that was given magnesium in its food, and another category of rat that did not have magnesium in its food. And both rats were given concussions, and the damage to the brain was actually measured and found that in the rats that were given magnesium, the damage to the outer part of the brain was reduced by 2 millimeters. These images help to show what actually goes on in the brain following a concussion or multiple concussions. On the left side, we have a normal brain on the top left. On the bottom left, we have a retired NFL player with CTE, or chronic traumatic encephalopathy, after sustaining multiple concussions. You can see the atrophy or the shrinking and the damage to the base of the brain. And on the right side, we have another rat study that was using magnesium, and we have one group of rats that were fed magnesium in their food on the top right, and on the bottom right we have a group of rats that were deficient in magnesium, and both rats sustained concussions, and you can clearly see that the rat that was deficient in magnesium has a very large bruise in that part of the brain, the darker area in the area called the hippocampus. It looks just worse and bruised compared to the picture on the top right. That was the rat that had magnesium in the diet. So we can see that if you are sufficient in magnesium prior to a concussion, it also helps prevent some of the damage after a concussion, but you can use it following concussion to help heal the damage as well, as we just saw in the case with the patient had a reduction in it. Another tool we use to treat concussion and post-concussion syndrome is fish oil. And fish oil is a type of fat that has EPA and DHA, which have been shown to actually heal and help repair some of the damage to the neurons following a concussion. And this is something that's being investigated right now by some of the military research, like Captain Joseph Hibbelin, who has found a low omega-3 ratio to omega-6 ratio in the military, and he is doing a study right now, and he's also found reduction in suicidal behavior and depression through fish oil supplementation. We also have Colonel Michael Lewis, who has used fish oil to treat concussions, and he's had great results to that. The images here show on the left a normal rat brain. In the center we have a controlled cortical impact or a concussion to the brain, as well as on the right we also have a concussion to the rat brain. The only difference between the middle and the right is on the right side, those rats were supplemented with omega-3 fish oils, and you can see clearly that the omega-3 fish oils protected the neurons from breaking apart, because what we're looking at right here is we're looking down through the axon of the neuron as if you were looking through a tunnel. And so on the left side you see that all of those tunnels or all of those axons are intact. In the center we can see that in that impact we have that neurons were actually broken open, and on the right side the fish oil protected them from breaking open. So fish oil can be useful prior to a concussion because it prepares the neurons and makes them more resilient or resistant, but it is also useful after a concussion because it helps repair some of the damage. These images demonstrate the usefulness of omega-3 fish oils in concussions. This is a rat study that was performed. On the left side we have a normal rat brain. What we're looking at is the axons of the neurons. We're looking down through the axon of the neuron, almost as if you were looking down through a tunnel. And those are normal because there's been no head injury. In the center we have a controlled cortical impact. We can see the ripping open, the breaking of the neurons, and on the right side we can see a controlled cortical impact or a concussion. However, that rat was treated with omega-3 fatty acids from fish oil. So you can see that those neurons were more resistant or resilient from breaking or ripping open due to the fact that the rat was preloaded with omega-3 fatty acids, which protects the brain. Not only does it protect the neurons from breaking open, however, it also helps heal the damaged tissues and recover from concussion. Another treatment that we found to be very helpful in treatment of concussion and post-concussion syndrome is hyperbaric oxygen therapy. And that is a treatment whereby which you breathe in oxygen and also you are in a chamber that is under pressure, which forces the oxygen at a higher concentration than you could actually breathe into your bloodstream and into your brain, which helps heal the damage from the concussion. On the right side, you can see the actual chamber that we use in our clinic, and it is inflated. There is somebody in it breathing oxygen and also under pressure, akin to about almost 50 feet of being underwater. That's the level of pressure that you would experience inside. We have patients go in there for about an hour, 3 times a week, if possible, and what we've seen is a gradual reduction in concussion symptoms with that treatment. On the left side here, we have another animal study that shows a reduction in damage to the brain in animals that were treated with hyperbaric oxygen. On the bottom 2 images, you see that was the group treated with oxygen. There's less damage compared to the images on the top. This next study is very relevant to our treatment of veterans because they took 16 military veterans and used 1.5 ATAs of hyperbaric oxygen. That's the mild hyperbaric oxygen therapy in the chamber that you just saw in the previous slide. And what they found was a significant improvement in post-concussion syndrome symptoms such as headache, sleep, memory, cognition, energy level. What's interesting is they also recorded a reduction in PTSD symptoms. However, I think that this is due to the fact that there's an overlap of symptoms between PTSD and concussion, and on the checklist, if they had indicated a reduction in sleep quality and some of these other symptoms, they would technically show up as having less PTSD. However, I think that to get rid of some of the psychological traumas takes additional therapy beyond what you would get from hyperbaric oxygen, and the results with reduction in PTSD are probably just due to the fact that some of the symptoms are the same. This is a great study though, and it really validates the hyperbaric oxygen, especially in military subjects. This is another case from our clinic that demonstrates how useful a comprehensive program can be in treating concussion. We have a 36-year-old man who presented to our clinic with a 3-month history of daily headache, neck pain, dizziness, and insomnia after being in a motor vehicle collision. After he was in the collision, he got out of his car, slipped on ice, and hit his head on the ground. So he had whiplash and concussion. And after he came into our clinic a few months later, we started with hyperbaric oxygen, magnesium supplementation, and I was performing chiropractic manipulation to his neck to treat his whiplash. And with all of these therapies, incorporating hyperbaric oxygen, he noted over 75% reduction in his headache, and he really started to improve. And after this, he improved even more, and now he's getting back to work as well. He can sleep, and a lot of his symptoms have gone away. And in this picture down below, we can see that hyperbaric oxygen actually opens up the blood vessels and delivers more blood flow into the brain. Those red areas are where more blood flow is delivered immediately after a hyperbaric oxygen treatment in a patient. Not the patient I've just talked about, but in another case that was published. Another tool that we use to treat concussions is laser therapy, and this is a very, very new type of therapy. Only in the last couple years have we started to see research come out on this treatment for concussion, but out of Harvard, there were 2 studies published within the last 2 years that demonstrated efficacy of laser treatment to the head and LED treatment to the head for concussion. And I've listed here the 11 patients that were published in the 2014 study. They saw a reduction in symptoms of concussion symptoms and PTSD symptoms. As I said before, there's an overlap there, but very many of those patients got better. They also found it was very, very safe, no adverse effects. And another study was repeated in 2015, and they had 10 patients in that study as well, and they saw very great results from both studies. Here's a case from the 2015 study. Very relevant to the talk here is a veteran of Iraq and Afghanistan. He presented to the clinic with a 2-year history of sadness, depression, irritability, very many PTSD and post-concussion syndrome symptoms, and 20 sessions of laser therapy to the head. Almost all of his symptoms went away except for the headache and the cognitive difficulties. Significant improvement in that case. That was not even the most dramatic example that they published in that study, listed below by Maurice. They had a Vietnam veteran who had post-concussion symptoms for 20 years following a blast injury, and all of his symptoms went away. So in this Iraq veteran, he had over 12 blast injuries, and that's not uncommon. So as I said before, there may be an underreporting, but we have over 250,000 concussed veterans, and many of them have had multiple blast injuries. The thing with blast injuries is that one does not have to be in the blast. You can be far back away, and you are actually hit from a pressure wave or a wave of wind. That is enough by itself to cause a concussion. On the images on the right here, we see some of the research in animals that show that laser treatment prevents the neurons from degenerating. Like I said in the beginning, we have a release of calcium from some of the neurons that rip open, and that calcium can actually destroy additional neurons as well as the inflammation and the other damage that's going on. So we have a lot of neurons that can die, and with laser treatment, it's been shown that the laser will reduce the amount of neurons that die following a concussion. And so every green dot is a dying neuron. On the left side there's no laser, on the right side there is laser therapy. There's less green dots, less dying neurons. And on the bottom we have the new neurons. So those pink dots, the neural stem cells in the brain, can actually divide and create new neurons after a concussion. On the left side we see there are a few pink dots, there are some new neurons, but the laser greatly speeds up that process. We see many more neurons forming after the concussion, and that is due to the fact that the neurons can actually divide and stimulate new neurons to form. And this is something we didn't even know 10 years ago was possible, but now we know not only is it possible, but laser will help with the neurogenesis or the new neuron formation. Another therapy that can be very useful for concussion and post-concussion syndrome is chiropractic care. Chiropractic manipulative therapy to the neck joints, to the upper back, soft tissue work and stretches to the neck muscles can be very helpful, because in many cases of concussion there is an associated whiplash that contributes to or worsens the symptoms of concussion. Because the reason why that happens is it is actually easier sometimes to get whiplash than it is to get a concussion. It requires only 6 times the force of gravity to get whiplash, whereas it requires about 60 to get a concussion. So it is oftentimes easier to develop whiplash, and many cases of concussion also have whiplash, and that's where chiropractic fits in, because we can address the neck, the cervical spine, and address the damage to that is feeding into the symptoms such as headache and the neck pain and the other symptoms that can go along with concussion. So here's a case from our clinic. We had a 12-year-old cheerleader. She had a flyer fall on her head. She was on the bottom, and 4 weeks later, this is considered post-concussion syndrome. She's still having headaches, nausea, and blurred vision. And so chiropractic manipulation and stretches were performed on the neck, and 1 session of hyperbaric oxygen, almost all of her symptoms went away after that treatment. So that patient responded very well, and many patients with post-concussion syndrome benefit from chiropractic. So the take-home message here is that it's easy to start getting treatment for post-concussion syndrome, concussion. It's as easy as getting magnesium, fish oil. These are things that are very easy to find over the counter online to buy and purchase and just to start taking. You don't necessarily need all the fancy technology. You can. In our clinic, we offer the laser, the hyperbaric, the chiropractic, but just to get started right now is something you can do. And to heal the brain is something that's very possible. I've seen it happen in many patients. And so if you're a veteran, if you're an athlete, if you're anybody with a concussion, if you've been in a car accident, start right now, get evaluated, have somebody look at you, and let's see what we can do to get you better.